The effects of microbiota on anxiety, depression, and related mental health factors. The human body and gut microbiota exist in a beneficial relationship. This symbiotic relationship performs some essential bodily functions like aiding in digestion, nutrient absorption, immune system regulation, and the production of these vital substances like vitamins and neurotransmitters. Uh, the gut microbiota plays a significant role in producing serotonin and dopamine, which these neurotransmitters ultimately really affect our mood, emotions, and sleep. Dysbiosis and mental health have a lot of implications. As we've learned, dysbiosis is an imbalance in our gut microbiota. We don't know what causes it exactly, but diet, stress, antibiotic use, and age contribute to it. This can ultimately impact our mental health and increase feelings of anxiety and depression. The gut brain axis concept is there's a bidirectional communication between our gut and brain. They're connected through the gut brain axis, allowing for communication. This influences our emotion and mood and potentially mental health. A healthy gut microbiome is essential for our well-being, specifically our mental health. So maintaining a balance through dietary interventions, stress management, and other lifestyle factors may ultimately help mitigate symptoms of anxiety and depression. The objective of my research is to see if dysbiosis affects feelings of anxiety or depression, if there is a relationship between gut microbiota composition and anxiety and depression symptoms. Also, can gut microbiota be a cause of stress, anxiety, and depression, or vice versa? To start my analysis, I looked at this article that reviewed existing literature on the association between our gut microbiota and neurocognitive and mental health disorders. The article highlights this new and exciting field of research, the gut-brain axis, pictured in Figure 1. It provides a broad overview of the existing literature that covers various neurocognitive and mental health disorders. It suggests potential therapeutic interventions such as probiotics and fecal microbiota transplant, which helps microbiome and improve mental health. The limits include the study varied in design, making it challenging to draw definitive conclusions. So the review suggests a strong association between gut microbiota and mental health disorders, but not causation. The review highlights the potential of gut microbiota-based therapies, but more clinical trials are needed to evaluate the safety and successfulness of them. So future research should focus on randomized controlled trials to establish this causal link between gut and mental health, and more research is needed to ID specific microbial biomarkers that can be used to diagnose and monitor these mental health disorders. The next study examines the relationship between the meal habits, gut microbiota, and cognitive outcomes in children and adolescents. The strengths of the study are that it's a longitudinal design, so it allows us to see the changes over time, which is valuable. It's a diverse sample, so it includes many participants from schools and community centers, which enhances the broadness of the findings. And in Figure 1, it's just kind of an overview of the design of the study. Some of the limits are that it's a smaller sample size, but it can reduce statistical significance, and it relies on self-reported dietary intake, so it could introduce bias of people over or under reporting. And again, it's a correlation. It makes a correlation between diet, microbiota, and mental health, so it can't establish causation per se. Future research should include a control group to compare different dietary patterns or probiotic interventions. Food diaries could help improve accuracy of self-reported data, and longer-term follow-ups could also improve for us to have more insight into the effects of dietary intervention on mental health. This next study investigates the efficacy of probiotic supplements in improving symptoms of psychosis, anxiety, insomnia, and anorexia in individuals using amphetamine and meth. Some of the strengths are that it employs a randomized controlled trial. It focuses on probiotics used to address specific symptoms associated with amphetamine and meth use. It measures relevant outcomes such as anxiety, insomnia, and psychosis, which are directly impacted by substance use. But there are limits. It's a short-term follow-up period, which limits the long-term effects of probiotic supplements. It would need a larger sample size, and there's still potential for bias in self-reported symptom measures and total adherence to the intervention. So longer-term follow-up studies could help give us more insight into the continuous effects of probiotic supplements, and along with a larger sample size, investigating probiotics with other therapeutic interventions like psychotherapy, medication, that could be promising. And the figure shown here, figure 2, shows it's significant that the individuals taking probiotics experience greater increases in appetite. This study examines the effects of probiotic treatment combined with biotin, vitamin B7, on depressive symptoms using a random controlled trial. The study objective is well defined. It focuses on probiotic and biotin supplement in reducing depressive symptoms. And the Hamilton Depression Rating Scale is a well-established tool for assessing these depressive symptoms. Again, it's a smaller sample size. As noted in figure 1, there's only about 47 total participants. And they are self-reported questionnaires which can introduce bias and not accurately reflect the severity of the depressive symptoms. Short-term follow-up also doesn't capture these long-term effects of intervention. So further research should include a longer follow-up time, larger sample size, and the authors didn't include an objective clinical assessment to assess the reliability of the results. This study evaluates the effects of probiotic LB15 on anxiety-like behaviors of mice fed a high-fat diet. It uses a controlled animal model, so there's a clear cause and effect relationship possibly to be established. The findings from the study have implications for development of probiotic interventions to treat anxiety and related disorders on humans. The study objective focuses on the effects of specific strain on anxiety-related behaviors, neuroprotection, and neuroinflammation. Although it's an animal study, so it may not always translate directly to humans because of our physiology and different gut microbiota, and it focuses on just one probiotic strain. So future research should research different probiotic strains and combos of strains, which will lead to more effective identification of intervention, and we'll need to conduct a human clinical trial to essentially confirm the findings for the animal studies and assess the efficacy and safety of probiotic intervention. And the figure shows that probiotic supplementation can decrease the negative effects of a high-fat diet on inflammation markers in the body. So this suggests a potential therapeutic role for probiotics in mitigating the adverse effects of high-fat diets and reducing the risk of inflammatory diseases. This last randomized controlled trial aims to assess the effectiveness of probiotics in managing alcohol use disorder in male adults. The participants are randomly assigned to 3 groups: probiotic, placebo, or acceptance and commitment therapy. The study found a probiotic treatment will provide more effective options for clinicians treating AUD by limiting relapse and maintaining abstinence. So overall, the study has a strong design with use of this RCT. However, these findings may be limited due to the focus on only adult males of the relative small sample size. The figure shows only a 6-week follow-up, but this trial is still ongoing, so there might be more significant findings. To conclude, the research suggests a strong link between gut microbiota and mental health disorders like anxiety and depression. While various approaches can contribute to a healthy microbiome, dietary changes and probiotics appear to be promising interventions. However, limitations in sample size and study design highlight the need for further research to establish these definitive conclusions. Future studies should focus on identifying specific mechanisms of action and exploring the potential benefits of probiotic in diverse populations. Thank you for listening, and these are my references. Bye-bye.